My name is Dr. Joan Rawlins, and I'm the president of the Alzheimer's Association of St. Kitts and Nevis. And I'm going to be talking about Alzheimer's disease. Well, many of you, I'm sure, already know something about Alzheimer's disease. It's a very, very complex condition. It happens to many different people. It happens all over the world. Alzheimer's disease is one of the dementias. It's a dementia. And a dementia is just an umbrella term for a number of conditions where the symptoms show similar to Alzheimer's disease. I should say it's an umbrella term. And in these conditions, which are part of the dementia, we see change in people's cognitive behavior over time. Alzheimer's is the commonest form of dementia. So for example, if you have a relative and they say your relative has dementia, they might not tell you exactly which kind, but chances are it might be Alzheimer's, because 70% of all the conditions that they refer to as dementia would be Alzheimer's. It's the commonest form of dementia. So what else can we say about Alzheimer's disease? We can say that it's no respecter of persons, okay? Alzheimer's disease is no respecter of persons. It can affect you whether you are white or black or brown. You can be affected by Alzheimer's disease. It can affect you if you are male or female. And it happens a little bit more often. It's more common in women than men, but it happens to anybody. People say sometimes, why is it that more women have Alzheimer's disease? And some time back we would say it's because women live longer, because women live longer. In most countries that you'd go, you'd find that women live 4 or 5 years longer than men. But of late they're saying it's not just because women live longer, okay? So it happens more frequently in women, but not only because women live longer, but also there's a kind of hormonal effect as well. So it's something to do with women's hormones. And what we're finding is that Alzheimer's disease is occurring more frequently in the developing countries. So here we are without all the resources we would need to cope with the condition, and yet we are having more Alzheimer's disease proportionately than in other places. And of course, Alzheimer's disease is not an easy condition. It's difficult for the person with the disease, and it's difficult for the caregivers of the disease. So what else do we want to say about Alzheimer's disease? We sometimes speak about the 10 warning signs of Alzheimer's disease, okay? Because Alzheimer's disease affects one's memory, it affects one's thinking, one's ability, one's behavior. It affects so many things about the individual. But the first thing people will sometimes talk about would be memory. They will say, oh, my mother doesn't remember anything, she's always repeating everything. Or my grandfather, you know, I don't know what is the matter with him, you know, he's just so forgetful. So memory loss is the first thing we're likely to notice. But I should hasten to add that it's not the kind of ordinary memory loss. All of us will forget something from time to time. We forget where we put our mask, we forget where we put our keys, and that is so common. All of us do this. We're going down the road, we're going to go shopping, and we pick up our phone, and we pick up our sunshades, and we pick up, you know, our keys, and when we get to the corner of the road, we remember we don't have our mask, and we have to fly back up to the house to get the mask, okay? So it's not that kind of memory loss. The kind of memory loss that we're talking about for Alzheimer's disease is the kind that disrupts daily living. It's a kind of very disruptive memory loss. It's a kind of memory loss that, you know, you go out the house, you go down the road, and you can't find your way back. You don't know the way back. It's that kind of bad memory loss. Or it's the kind of memory loss where when you put down something, you can't remember where you've put it. And because you can't remember where you've put it, you accuse the next person of moving it. You say to them, you move my things, eh? Why did you move my things? Okay, don't trouble my things. But they haven't troubled your things. You have put it where you can't remember where it is. And so you can see that leads to tension and confusion in the home, because you, the person with the dementia, with the Alzheimer's disease, you're accusing people, and people are getting tired of you accusing them of things. And so there's tension there. So as I say, memory loss is usually the first thing that people might mention, but it's not the only common sign of dementia. Other things would be like space and time. People might not recognize that this is a big room. They might think it's a smaller room or something like that. They might not know the time of day. They might get up like early in the morning, like 2 o'clock, and start sweeping the house and making the tea and making the breakfast. So there's a confusion about kind of time and space, that kind of thing. They might also have personality problems, where they have been nice and outgoing and friendly, and they're not so outgoing and friendly anymore. Also, people's behavior might change in a different way. It might change in the way that, I'm trying to think of the exact term I mean to refer to it, where they cannot make decisions properly. So if say they have neighbors who are not their good friends, they might begin to invite the neighbors into the house. Inappropriate behavior, that is the term I was thinking about. So inappropriate behavior becomes part of their lifestyle. They might have like workers in the yard, like a carpenter and builder and so on, and they might invite them in to have a proper meal, sit down at my table, bring out all my fancy goods and so on and put it on the table. So that's inappropriate behavior. So that is not normal. And so that would be a little bit of a sign that might suggest to you that the person is going down the path of Alzheimer's disease. So, as I say, the other ones, like forgetting people's names. All of us have kind of memory lapses, and if you haven't seen someone for a long time, if you have an old school friend and you haven't seen the person for 30 years, when you see them, you'll remember them, that you know them, but you go, what's the name? Can't remember their name. That happens to all of us. So that's okay. Occasional memory lapses are okay. But the people that we see every day, I mean, if one morning I wake up and I can't remember my husband's name, that's a sign that something is not right. I should remember his name because I see him every day. So those kinds of things. So there are about 10 common things that are associated with early Alzheimer's, and when you see these, you might wonder what is happening. But of course, you need to take your relative or your friend or whoever it is, or yourself, to the doctor to get a proper diagnosis, because sometimes these conditions, these behaviors that we see and that we refer to as Alzheimer's disease are not. Some other condition might be manifesting itself as such. It might be that there's anemia, some other problem with your thyroid. So there might be something else that is going on. And you should not seek to diagnose this condition yourself or diagnose your relative, because you need a proper diagnosis of this. Another thing is, we like to think that people should get an early diagnosis. An early diagnosis is important, because if you see all of these things happening and you don't do anything about it, it could lead to real confusion and serious problems. I'll give an example of the kind of thing that could happen. So if your relative is going down this path, the path which will later be diagnosed as Alzheimer's proper, and you don't do anything about it, this person can become very disoriented, might wander about through the neighborhood and cause confusion. I remember one day many years ago when I lived elsewhere, my neighbor was going down this path and he was totally disoriented. He was going down the road, checking everybody's car, trying to get into people's car, going down as he walked down the road, because he wasn't supposed to be out of the house. He was supposed to be minded by his granddaughter, who in a minute that she took her eyes off him, he was down the road. And that's another problem with people with Alzheimer's. They can wander away from home and get lost. in the course of the many years that I've been involved in Alzheimer's work, I've been involved in Alzheimer's work now for maybe almost 20 years. In the course of that time, I've heard of many cases where, when I say 20 years, not 20 years in St. Kitts, I've 7 years in St. Kitts and other years elsewhere. Where I've seen many situations where people's relatives wandered away from home, could not find their way back, ended up in a cane field, was there for many days, became dehydrated, and some of them died because they just did not know how to get themselves home again. So that's one problem. If there's not an early diagnosis, there can be disorientation. There can be problem with medicines, right? All of us probably have to take a medicine of some kind from time to time. You might have to take one aspirin or one other kind of pill, or pill for your diabetes, or pill for your hypertension, or whatever. But if this person now has Alzheimer's dementia, remember, their memory is not so good, their thinking is not so clear, their reasoning is not so good, because this is what happens with Alzheimer's. And they don't know that they have this problem yet, and you, the relative, don't know they have Alzheimer's, then they might over-medicate themselves. They could take more medicines than they need to take. They might forget that they've already taken it for the day and take it again. So those are the kinds of things that could happen. Car accidents, there could be accidents. I mean, I think of another case that I know of where this elderly gentleman had Alzheimer's, but he had not yet been diagnosed. And he would be driving his car. He would forget where he's going, forget that there's a traffic light, go through the traffic light, and he had several fender benders, minor accidents, until he had because his wife was trying to get the car away from him. She was saying, you can't drive anymore, you can't drive anymore. And of course, you know, most men are kind of very stubborn, they don't like to be told what to do. And so he couldn't get the car away, she couldn't get the car away from him. And eventually he had a very serious accident, and only then were they able to, you know, tell him for sure and get him to understand that he could not drive anymore. And of course, by that time they had him properly diagnosed, and he was an early case ongoing of Alzheimer's disease. So those are some of the kinds of things that can happen when there is, if we don't get an early diagnosis. Apart from all of what I've said already, when someone has Alzheimer's disease, in the early part of it, that individual knows that something is not right. They begin to feel in themselves that something is not going on quite right. Now, if they could get a diagnosis, they would know, because they begin to think they're crazy. I don't even like to use the term crazy, because there's nothing wrong with people who have psychiatric conditions, nothing wrong in the sense that we should not be helping them. Everybody needs help. But the person in the early stage of dementia might think that that is what's wrong with them, and you know how the kind of stigma that's attached to these kinds of things, and so they become very frightened. But once they've been diagnosed and they're told you have Alzheimer's disease, it's a disease of the brain, it's a progressive disease, and we will see what we can do to help you. And so people, they're not happy to know that they have Alzheimer's, but at least they know they really have something going on. Because what we find with Alzheimer's disease is that many times relatives don't believe the individual has anything wrong with them. They think, you know, this is just a person who's miserable, this is a difficult person, this is a person who's been difficult since the time they were young, and now look at them, they're old and they're still difficult, okay? So once we have a proper diagnosis, then the individual knows he really has something wrong, and the relatives really know that there's a proper diagnosis, there's something really wrong, it's not just old age, or it's not just miserable behavior. And once they know this, then they can begin to work out a plan to help that individual. So, you know, those are the kinds of things to do with early diagnosis. I've already said that men and women get the condition. I've already said that race, gender, whatever, you open to that condition as well. I should also mention, though, that although it's not a disease of aging, in other words, not because we grow old we will get Alzheimer's. It doesn't work like that. It's not a disease of aging. You're not going to get it just because you're old. But it does does tend to happen more with people who are from the age 65 and onwards, okay? But it's not just old age that causes it. All right.
Yes.
So, yes, so that's part of that. Now, let me see. What else can I say about Alzheimer's disease? Sam, can I say anything else?
Did you say anything about the frequency of the disease in worldwide or frequency here in St. Kitts and Nevis?
Okay. All right. So I could talk a little bit about the frequency of the condition. I had mentioned already that we're seeing more of it in developing countries than elsewhere. An interesting thing, though, is with this COVID, you know, we have to look at Alzheimer's disease in relation to COVID, because COVID has changed the world. The world is not the same place as it was before. So many things have happened, and people with Alzheimer's disease have been also affected negatively by the COVID. They've been affected in the sense that life was always difficult for them, life was always difficult for caregivers. And you know, I must talk about caregivers in a minute, but I just want to say something about COVID and Alzheimer's disease. Because we've been fortunate that here in St. Kitts, we've had only a few cases relative to some other countries, so we're fortunate in that sense. We haven't had to deal with large numbers of people, and I have had no report of the 22 or so cases that we've had in St. Kitts and Nevis. Nobody has died, and I haven't had any report that anybody with Alzheimer's had it. In fact, I don't think that was the case for anybody. But in other countries abroad, many of the people who had the COVID were people with Alzheimer's dementia because they were living in institutions. And in the institutions, they were affected and or infected, and many of them died. So, you know, we say that Alzheimer's disease is a disease that affects people, you know, who are largely over the age of 65. Some of them are in old people's home, and a lot of them were killed off by the COVID. So maybe we have fewer people in the world with Alzheimer's disease now than we did at the start of this year, largely because of the COVID situation. You know, sometimes the question that people sometimes ask about Alzheimer's disease is, they say, is it a genetic condition? Does it mean that if my mother or father had the disease, that I'm going to have the disease too? And the Alzheimer's disease is such a complex condition that it's not easy to answer that question. I'll answer it in two ways. In that Alzheimer's disease, there's something called early onset Alzheimer's, right? And the early onset Alzheimer's, it's only 4% of cases of Alzheimer's will be the early onset. Most of the Alzheimer's will happen at a later age. And the early onset one is the one that's in the genes. You know, it's a genetic thing. It's a specific gene, the APOE, E4 gene, that will lead to Alzheimer's disease. But that's usually for people who are less than 48 years old, and that's a small number. All right, but to go back to the other thing about it, people say, well, my grandmother had it and my father had it, and you know, will I get it? And the probability that someone will get Alzheimer's disease because their grandfather had it and then their grandmother and so on is higher, it's a bit higher than for someone who has no relatives who've had dementia. But it doesn't mean that if your father had it or your mother that you will get it. But if your father's father or your father's mother, or if there's quite a generation of it, so to speak, chances are, you know, your probability will be higher than someone who has no Alzheimer's in the family. Now, people will sometimes say, does your lifestyle have anything to do with Alzheimer's disease? And I would say that the research which is ongoing says that lifestyle can affect your risk for Alzheimer's disease, your lifestyle. So what we would do is we'd encourage people to, you know, have an exercise, eat a healthy diet, you know, get adequate rest, try to reduce their risk for hypertension and reduce their risk for diabetes, because we know, for example, that 50% of all diabetics, the high probability that they will also have have Alzheimer's in the end. So ideally, we want to reduce our risk for hypertension or a risk for obesity and a risk for diabetes, because it has been shown that there is a lifestyle link. It's also shown that there is a nutrition link too. So if you eat healthily, they say what's good for the heart. So if you eat a heart healthy diet, that will be good for your brain, because remember, your brain is what is affected in Alzheimer's disease. In Alzheimer's disease, plaques and tangles form in the brain. That is what causes the confusion. With Alzheimer's disease, there are plaques and tangles which form in the brain. So if you imagine something gets all knotted up, it's not going to work the same as if it was nice and smooth as when it was nice and smooth before. So these plaques and tangles form. The messages in our brain, which normally go smoothly to our brain from one part to another, can't travel smoothly anymore. So you might have a message that your brain is saying, move your right leg. But because the tangles and plaques are there, your right leg won't move. The message is there and is sending, but it can't go to where it needs to go because of the changes in the brain and because the brain is smaller than it used to be before. So that's what happens with Alzheimer's disease. Now, I had mentioned, I want to go back a little bit to just a little bit with the COVID. So with the COVID, we're all having to change our behaviors. Yeah, we're having to sanitize, wear a mask, we're having to social distance, and all of those things that we're now required to do with the COVID. So you can imagine if you have a relative in your house who has Alzheimer's, how are you going to get them to do all of these things that we now that we have to do? One, remember, people cannot understand the same. Even if you tell them, they won't remember the same, and they can't think so clearly. So there you are. You need to take this person with Alzheimer's disease to the doctor or to some other health place you need to take them. And you say, put on your mask, and you tell them to put their mask on, and of course they take it off as soon as you put it on them. And they can become a little bit annoyed. One, when they see everybody around them in masks, they don't know who people are anymore. I mean, I walk down the street myself and I see people waving to me and I don't know who they are because they have on their mask and they have on their sunshades and I don't know anymore who they are. So you can imagine the poor person with the dementia who it's really confusing. And so, we have to give a thought and say a prayer for people with dementia in these days, and a thought for their caregivers as well, because caregiving was always a very difficult task. Caregiving for any ill person, but caregiving for people with dementia is much more difficult. In fact, the research about caregiving says that people who are caregivers of persons with dementia, they are likely to end up sick themselves if they're not careful, end up depressed, end up with all kinds of issues because of the stress of caregiving. I can hardly ever speak about Alzheimer's without spending a little time talking about the caregiving issue, because caregiving is key to the management of Alzheimer's disease. In the early part of the condition, the person with dementia will be able to help themselves somewhat. And as they help themselves, you can, don't try to overdo it and do every last thing for them, because that is not good. Let that person manage as much as they can for as long as they can. Okay, but later on, it will become a little bit more difficult. And the caregiver has to have patience, and more patience. If you're a caregiver of a person with dementia, you have to have the patience of Job and more, because your life is going to be difficult if you don't have the patience. And remember, there's no point in arguing with someone with dementia. You can't argue with them. You're just going to get frustrated. It doesn't make any sense. So don't argue with them, and don't say to them, remember, I told you so yesterday. They don't remember you told them so yesterday. So there's no point in telling them, remember, I told you yesterday. You have to just be patient, show love as much as you can, show love. I know it's not easy sometimes, because as a caregiver, you'll be stressed out, you'll be tired, and it's hard to be the best you can be when you're tired. So I would just say to the caregivers out there, be sure to get someone to help you with the caregiving, because caregiving 24/7 will just break you down and ruin you. You just cannot do all of that caregiving 24/7. So you have to make arrangements with relatives to give you a break and help you out. And you know, that is where an organization like our Alzheimer's Association comes in. We provide support and encouragement to caregivers and people with dementia as well. In the normal run of things, we have our meetings once a month, the third Monday of the month. And we encourage people who are caregivers to come to our meeting so that they will learn more about the condition, so they will learn that, you know, how to take good care of their relatives. And in taking good care of their relatives, they need to learn about the disease. They need to learn everything that they can about the disease. When they come to the support group, they are around people who understand what they're going through. These are people who would have experienced some of this already, and they can tell the person who is doing the care what are the best practices, how to manage a particular condition. For example, you might have a relative who doesn't want to eat, you know, so there'll be somebody in the support group who might have had a similar problem, and they will tell you how they got around that. There might be someone who's restless and aggressive and always fighting with the relatives. And when you come as a support person to the support group, you will hear from them how to best manage. People with Alzheimer's disease, for example, the behavior is different. So they might not want to take a bath. This is something a lot of people who have Alzheimer's struggle with, and the caregivers struggle with that, because they don't know what they're doing, so they might get messy, they might throw food on themselves, they might wet themselves, they might soil themselves, and yet they don't want to take a bath. So if you are a member of a support group, the people in the support group will help you, will tell you little by little how you can overcome those behaviors and therefore manage your person in a better way. And also too, people in the support group will not be judgmental. If you are the caregiver and you complain to the family members, you know, mama did that or grandmother did that, they're not going to be too supportive of you, because they'll just think you're fussing unnecessarily. So, and there might be other things you want to talk about, but you don't want to talk about it with them, the family members, who are already judging you and telling you you're not doing a good job. But when you come to the support group, nobody's going to judge you. You can lay it all on the table, and people will help you, they will give you support, and best of all, they won't take your business out on the street. They're not going to tell anybody what you have told them. So a support group is a good thing to be a part of. Now, something else which is very important that I want to talk about, and that is the business of reducing our risk for Alzheimer's dementia. Okay, Alzheimer's has been around a long time. In fact, dementia has been around, I suppose, for as long as human beings have been around. But it was about 100 years ago that someone called Dr. Alzheimer, Alois Alzheimer, German psychiatrist, he's actually the one who identified Alzheimer's as being specific. It wasn't just to be labeled dementia. It was something very, very specific. And, you know, as I've been talking about Alzheimer's, you know, you see that it's those of you who've nursed or cared for people with Alzheimer's, you will know that they behave a bit different from people who have other kinds of dementia, okay? So he identified this almost about 100 years ago. And a lot of research has been done. And although this research has been done over all of this time, we still don't have a cure. There's no cure for Alzheimer's disease. There's no shot. You can't get a one shot for that. Even the medicines that are available only provide relief for a short period of time. You know, and this is the sad part of it. We all waiting. We're waiting for that cure for dementia. Some medicines are out there, but they help for 6 months, a year, perhaps a little bit more for some people. Some they help some people more than others. So we're still waiting. And because we've been waiting so long, it makes good sense that we should be looking at something else. Some people should be looking at, if we can't cure it, what can we do to prevent it? So there's that line of that. So before I go, I'm going to talk about how we might reduce our risk, but I just want to go back a little bit and say that, so there are some drugs, and they help a little bit. They help mainly with aggressive behavior, and they help with other behavior problems, and they help with restlessness, but they don't help forever. And in fact, one particular drug, I'm not going to call its name, which was most commonly used, I mean, where I've lived before, they used that particular medication commonly for all people with Alzheimer's. And now the research is saying, you know, don't use it anymore. It really does not help. And in fact, in the studies that they did, the people who got the placebo fared better than the people who had this particular medicine. And I think nowadays nobody's using that particular medicine anymore. All right, so we have drugs that might help for a little bit. Music therapy has been shown to work very well for people with dementia. You know, it helps in some way. And they have cognitive stimulation therapy, which is like people with dementia could go to group therapy, and they take them through, you know, several different kinds of activities, and it seems to restore their memory in part for a while. But the bottom line is Alzheimer's disease is progressive. It can only get worse in the long run. And I don't say that to scare anybody, because I know of people with Alzheimer's who've had the condition for 14, 15 and so years, you know, and they have lived a reasonable life. But the bottom line is the care. If the care you give the individual will make the difference to how they will progress and how they will manage. Now, to go back to the point I was making about risk reduction. Recently, there was a huge research that was done, and it was reported on in the Lancet, which is a premier British medical journal. The Lancet is a medical journal, and the research results came out in 2020. This year, so it's new research. And they looked at what we might do to reduce our risk for Alzheimer's disease, risk reduction. So if we can't cure it, if we don't have any good medicines, what can we do? And the research was good research, really good research, and they identified 12 factors which could could reduce our risk for dementia, 12. And the important thing about these 12 factors was that they were all modifiable. Modifiable means, as I've just said, we could do something about it. And they listed these 12 factors in terms of midlife risks and later life risks. Right, okay. So if you do these things, or if you don't do these things, you could end up with dementia in your midlife or in your later life. And I don't know if from my memory I could say all 12. I'm not sure I could say all 12 straight off from my memory, but I will say those that I can remember, okay? Hypertension was one of them. So if we can reduce our risk for hypertension, we will reduce our risk for dementia. If we can reduce our risk for diabetes, if we don't smoke, if we don't drink too much alcohol, if we don't get involved with air pollution, if we can improve our hearing. If say we have a hearing problem, but if we get our hearing aid going, then we will reduce our risk for dementia. I have a list somewhere of those 12, which I would really like to read that list.
Traumatic brain injury.
Yeah, okay, you were saying traumatic brain injury. If I can find my list, let me just read on my list, because I really would like to say what they are exactly. All right, I'll go with traumatic brain injury. So that was one. But there are 12 of them, and one of them, I don't know how much we can do about that. If you've had only little bit of education, that increases your risk for dementia. And that is a strange thing I found. I found that if you have very little education, you know, that increases your risk for dementia. Yeah. And I found that an interesting thing. Okay, and I don't know if it would apply all over the world, right? So anyway, they were these 12 factors that they identified. I mentioned obesity, I mentioned hypertension, I mentioned diabetes, I mentioned smoking, too much alcohol, traumatic brain injury, hearing loss, air pollution. Yes, those are some of those, and a couple more. And because the hearing loss one was such an interesting one, something that people don't normally think about, I believe, as related to Alzheimer's, I'd like to say a little bit more about it. Because they made the point that if you have hearing loss and it's treated adequately with a good and proper hearing aid, your risk for dementia is completely reduced. Your risk becomes the same as someone with perfect hearing. So that makes a good case. It makes a good case for everybody with any kind of hearing disability, peripheral hearing disability, to immediately go get themselves a hearing aid. Because dementia, Alzheimer's dementia, is not an easy thing. We don't want anybody to get that. I mean, if you already have it, well, you have it. But if you don't already have it, and we can reduce your risk for getting it, we need to do that. Because Alzheimer's is an expensive disease. In fact, the economists who work on the matter of health economists who look at things like Alzheimer's say that Alzheimer's is such a costly disease. In terms of the world cost, it costs trillions and trillions of US dollars each year. And if Alzheimer's disease was a country, it would have the budget of the country in the world with the 17th highest budget in the world, right? In other words, Alzheimer's is costly. It's costly in terms of time lost from work for the caregivers, time lost by government institutions. Think about all the supplies that you have to make ready for people with dementia. So we don't normally think of it as expensive, but the bottom line is when we consider it carefully, we will find out that Alzheimer's is an extremely expensive condition. So the powers that be then say to us, all of us here who are concerned with Alzheimer's disease and our relatives and dementia, we should do everything we can to ensure that if we have any relatives with peripheral hearing aid, to get them their hearing aid. And we should get the governments and policymakers to make that a priority. So, you know, we get food for people and we get whatever else we give to older people. We should put hearing aid on the top of that list as well. Another risk factor which is not commonly understood. People understand perhaps that, you know, diabetes will be a risk factor, or hypertension or something like that. But another thing I think people had not considered was the business of air pollution. Air pollution is a risk factor for dementia. And thankfully, here in St. Kitts and Nevis, we don't have a worrisome air pollution. In fact, I've lived in places and been to places where you can smell the pollution and see the pollution in the air. So I would say St. Kitts is just amazing where air pollution is concerned. I don't see any air pollution that I would be worried about here in St. Kitts and Nevis. But air pollution is a risk factor. And the research shows that people who live in polluted situation, air situation, that they have failing health in their older years, and dementia is a part of that. Now, what is it that causes air pollution? And the pollution they're talking about is like the pollution from cars and trucks, from construction, building construction and other kinds of construction, and industrial work. So in some countries there are lots of factories in those countries, and the factories are belching out all kinds of, you know, nasty stuff all the time. And the people who are breathing in that pollution, they are the ones who will become affected and will end up with dementia. They did mention, though, in the research that not all pollution, so not every kind of pollution would lead to dementia, but so, you know, but some would. And how does it affect the brain? You can breathe it in, it goes directly to the brain, and sometimes it gets into the bloodstream, and so on, leads to inflammation, and we know that inflammation is bad for the body all around. Inflammation leads to higher cholesterol levels and so on, and leads to dementia as well. So that was, of course, so those things are modifiable. You can get the powers that be, the government and policymakers, to clean up the air. And community action, you get people not to burn stuff in their backyard. I mean, you can burn maybe paper that would not be a big pollutant. But if you're burning things like tires and batteries and those kinds of things, you know that those are not going to be good for anybody. So with community action and government policy, we can help to clean up the air and reduce the risk for dementia. Another factor was traumatic brain injury, and those traumatic brain injuries are usually caused by people riding motorcycles. You know, so there's something we can do about that. We can ensure, pass laws to make sure people wear their helmet, have speed limits to make sure they are not racing about at super high speeds, and therefore we could reduce the risk of brain injuries and thus the risk for dementia. I've spoken a lot, and I don't know if anybody wants to ask any question, which would then give me an opportunity to speak about something more that maybe does not come to my mind at this moment.
One question, you mentioned, as far as I'm hard of hearing myself, and you mentioned that hearing loss has a relationship with brain atrophy.
Right, yeah.
And that has a risk to do with
dementia. Yeah.
So brain atrophy.
Yes, thanks.
Evidence that there's.
Yeah, there's real evidence that hearing loss, yes, thank you for that, leads to brain atrophy, because when people cannot hear properly, they tend to cut themselves off from people. They're not hearing, so they don't want to be in the center of the conversation anymore. They become frustrated, they sit in the corner, they become isolated, they're not mixing with people. And social isolation in itself alone can lead to dementia. But specifically with the hearing loss situation, that isolation which they get and from not hearing properly and not interacting leads to atrophy of the brain. And generally in dementia, with dementia, your brain is getting smaller. So there is that as well. Okay. Another question that people like to ask. You want to ask? Yes, yeah. Please. Yeah.
You said that people with little or no education stand a great time to get dementia.
Yes.
When you say little or no education, I want you to tell me what level of education you think.
Yes, good question.
They should have.
Right, good question. And you know, this is research that was done not in the Caribbean. Mm-hmm. Because we know in the Caribbean, there are many people with very little education. They are smart, they live to age 90 and they didn't get dementia. So we know that for sure, okay? Exactly, so I hope that answered your question, okay? So, you know, and things vary. I'm really glad you asked that question, because it takes me to another point. You know, the dementia, you know, plaques and tangles are forming in people's brains, right? And the CT scans will show that the brain is changing. And you know, some people might have experienced exactly the kind of life that a particular individual experienced. Almost everything was the same. And yet one will develop dementia and the other one won't. In other words, this condition is so complex that you can't predict with any certainty exactly what will happen. And in fact, what is said is that if you meet 10 people with Alzheimer's dementia, the 10 of them, they will behave differently. because the condition is so complex that it depends on what exactly the part of the brain is affected. And if one person might have the part that's affected that leads them to be super confused, another one it might make them more aggressive, another one, you know, might be more friendly and outgoing, and another one might just want to sit in the corner and do nothing all day. Okay, so there is that as well. It's unpredictable, it's complex. I mean, even the researchers and the doctors who worked with this for many years, I mean, they know, you know, and we'll talk about more or less what I've just talked about, but they will tell you it is very complex and it's unpredictable, and not every two will be the same. I met some people as early as 52 or 54 with Alzheimer's disease. It's called early onset, and it's not the genetic kind. I'm not talking about the genetic kind. I'm talking about the early onset of the regular Alzheimer's, early onset. And it's very sad when that happens. I remember this gentleman was telling me about his wife. You know, she was young. She was in her 40s, mid-40s, and she just began to behave very strangely after a while. You know, and one day they were sitting in a restaurant, and she just took up the plate and smashed it in his face. And, you know, he began to wrestle with her to make her quiet. And then the people in the restaurant didn't know what was happening and called the police because they thought he was fighting his wife, you know, and that she'd had to defend herself by hitting him. So it's very sad when that happens. Another case I know of was this lady. She was a nutritionist, very well-known lady and so on, working in a particular place, not this country, elsewhere, we're working in the hospital. And she developed dementia, full-blown dementia, and hers progressed fairly rapidly at age 52. So her parents, who were in their late 70s, became her caregivers. You know, so these two little old people in their late 70s taking on the management and care of this 52-year-old daughter. And it was very hard for them. They were both members of our Alzheimer's support group that I was a part of at that time. And, you know, I saw the wife in particular, the mother of the girl, deteriorate in a short time, because of the emotional strain of having to know that this is your daughter, somebody you hope would take care of you in your old age, and she was having to take care of this daughter who was so young and still with this condition. But you know, they managed the best they can. But in fact, the mother passed away before the daughter, and leaving the old man, the old gentleman, and he was thin. He wasn't even big-bodied or anything. This thin little old man taking care of the daughter. You know, so it's hard. Caregiving is hard for people with dementia, especially. And I will make the call again. I said it already. The caring has to be shared. You have to share the caring because it's not easy. Sometimes with dementia as well, we will find that the person who is closest to the person with the dementia, they get the hardest part of being with that person. That person takes out all their troubles on that caregiver. So, and I don't mean in the later stage, because in the later stage, a person with dementia is going to be bedridden and won't be able to do anything for themselves. In the earlier stage, when the dementia is just growing on them, you know, they'll accuse that person who loves them. You love that person to, you know, with all your heart, and you're doing the best you can every day for them. And they will give you trouble, not because they want to give you trouble. It's a disease. So, you know, when the relatives complain to me that their mother or grandmother or whoever is so difficult and awkward, you know, I say, you know, forgive them. Remember, it's a disease that's making them like that, okay? They're not doing it out of spite. They're doing it because they can't help themselves. And sometimes what the person with the dementia will do, they will give trouble to the, not because they want to, but it happens, to the person caring them. And when the other relatives who only come to visit once in a while, like at Christmas time or Easter, or they come from abroad, that person with the dementia in the early stage will complain bitterly to these visitors, you know, the one carrying me, doing me this, they're hiding my money, they're taking away my clothes, they're giving away my things, they give me nothing to eat or very little to eat. And these relatives who live abroad or who come occasionally, they will believe because they have never had the opportunity to do this hard work which the caregiver is doing. Okay? So I have to warn the caregivers, this will happen. Your person here you're caring will complain to the relatives, and the relatives will believe them because they don't know any better. But take heart. It's part of what you have to do, okay? And don't feel too badly about it. It's not you alone. I know in our support group, we sometimes have people who are the caregivers, and they come to the support group and they sit quietly and they say nothing, but they hear us talking about what happens and what we know, and somebody will get up and give a testimony of what happened. And at the end of the meeting, they'll just get up and say, I am so glad I came today. I am so glad because I thought only my relative behaved like that. And I'm really glad because now I understand.
Tell us about stigma.
Yeah. How's my time? Okay, go. Yeah. Okay, stigma. You know, I've been asked a question about stigma. Why is there stigma attached to Alzheimer's disease, or is there stigma? And I will say, yes, there is stigma. And the stigma is a situation where people don't want to associate or be around people with a particular condition. And when you stigmatize people, then you discriminate against them, okay? So there's a kind of stigma and which we're trying to break down in relation to Alzheimer's disease, because it's not something people cause on themselves, so to speak. It's not, you know, it's not, it could happen to anybody. You know, we've just talked about risk reduction, but still, it could happen to anybody. And what we need to do is to help people with dementia and not discriminate against them. And we can reduce the stigma through education. I'm going to water. Yes, so you know, by education, like how we're here learning about the condition, that way when we know about the condition, we are less likely to stigmatize people and discriminate against them. So part of the mandate of our organization is to go around to churches, community groups, and provide education to the community so that we will reduce the stigma which is associated with Alzheimer's disease. Because there's no need for stigmatize. And people sometimes, because they feel uncomfortable about Alzheimer's in their family, they won't even tell the neighbors. And that's a real disadvantage, because if you don't tell the neighbor, when the neighbor see your relative wandering down the street, they won't bring them back because you haven't told them anything. You know, so it's best for you to share the information with your neighbors. It's nothing to be ashamed of. It could happen to the neighbor as well, and therefore, you know, we should be wise about that. And as I say, part of what our organization does is we try to break down the stigma and educate people. And for that reason, every year in September is World Alzheimer's Month, and we're more active in our organization in the month of September. We do many things to highlight the condition, the situation of Alzheimer's, and to educate people about Alzheimer's disease. So that's what we do.
4 o'clock.
He's been my timekeeper. He doesn't want me to go over the hour. Yes. You know, so, and if the camera is still on, I'd just like to say, so do remember that we have a support group, and we encourage people to join the group. In fact, we're looking for more members, new members, younger members. You don't have to have a relative with dementia to be a member of the group. You just have to be concerned about the condition, want to learn more about it, and to help people. Thank you.
Dr. Rawlins, on behalf of Care Nursing Agency, just want to tell you thank you for that inspiring remarks you made.
Thank you so much. Thank you. It was my pleasure to be here. Thank you very much. Thank you.